Hi, this is Brian Kim. I want to share with you case number 282 in the Best Way to Do Cataract Surgery series. And the title of this series is not to suggest this is the best and only way, but to get you to think critically of your technique so that you can provide the very best for your patient. And so this is a soft lens. And with the soft lens, I have the ability to use a single OVD agent, which is Healon GV in this case. And so I'm going to be using the Veritas phacoemulsification handpiece. And you're going to see the power of the machine because it's very robust as far as being able to emulsify and remove the lens pieces. There's great chamber stability. And the Healon GV is actually a great viscoelastic for capsulorhexis. It has great space occupying qualities. The only downside is it doesn't coat the corneal endothelium very well, and therefore I reserve using the Healon GV throughout the entire case for soft lenses. So again, soft lenses, I don't have to use a lot of ultrasonic energy or vacuum, and therefore this is essentially a manual cutting technique using the double chop and cross chop maneuvers. So I'm using the cotton tip to steady the eye, and then using a corneal marker which will help me to center and size the rhexis. I make my paracentesis incision first on the right side and then the left side, making sure I'm parallel to iris plane, which creates a nice corneal shelf, which will allow me to achieve a self-sealing incision. This is intracameral epinephrine, and then some Healon GV. You can see has great space occupying characteristics. It pushes the capsule nice and flat, the anterior capsule. This is the triplanar corneal incision. I make a vertical groove, place the blade into the deep part of the groove, tunnel, and then I enter. That's a 2.4 millimeter incision. And using the cannula with the Orlock technique, I'm able to control the eye very well during my incision creation, as well as switching quickly to the capsulorhexis. And so I puncture the center with a Morio microrhexis forceps, pull down towards me, and I go around circumferentially. What's really cool about the Healon GV, minimal radialization forces. That's what I've experienced using this viscoelastic. You have great control of the capsulorhexis. In my mind, in my opinion, if you're a resident or very new to cataract surgery, using this viscoelastic is really ideal for capsulorhexis. The risk of runout is far lower than any dispersive viscoelastic I've ever used. And this is the capsule fornix hydrodissection technique. I place a cannula under the rhexis edge contra-incisionally, get a nice wave, lift the lens up, decompress the bag. And you can see already the lens begins to spin. So this is the Veritas phacoemulsification system. I am on peristaltic quadrant mode. I irrigate the surface of the eye, and I'm able to toggle on and off the continuous infusion with my foot pedal, which is really nice. And when I go in, on, and then off real quickly. Remove the surface epinuclear material, place the chopper under the rhexis edge contra-incisionally, tilting the phacotip vertically sub-incisionally, fracturing the lens in half, and that is the double chop. With the phacotip in place, I place the chopper under the right heminucleus, hooking the peripheral lens and pulling it centrally toward the phacotip, and that is a cross chop. And within seconds, I have three pieces. I'm able to lift the first quadrant up with some vacuum, and then emulsify the lens piece, getting under the second quadrant with the chopper, hooking it from the periphery, lifting it up out of the bag, and then emulsifying it. You can see I'm using very little ultrasonic energy and vacuum here. You can see the right side of the screen shows my aspiration vacuum, and there's very little power ultrasonic energy that's been used. I turn the second heminucleus in front of me and then fracture the lens with another cross-chop maneuver. And you can see I'm able to grab that third quadrant very easily using purely vacuum. And so the ability to grab pieces up out of the bag, is excellent with this machine. And that's it. So I take the chopper out, push BSS in, take the phaco tip out, and I go in with the INE handpiece. I adjust the sleeve here. Again, excellent chamber stability with this machine. Start sub-incisionally, sweeping side to side to tease the cortex from anterior to posterior. By peeling from anterior to posterior, this is the cleanest way of removing the cortex and minimizing those fine wisps that are very annoying to me. Might not be an issue for the patient, but as a perfectionist, I want everything to be as clean as possible. I'm able to peel off the cortex quite efficiently in this case, and then I polish under the rexus edge under polish mode. Turning off infusion and placing the cohesive viscoelastic cannula to fill the bag. Again, throughout the entire procedure, I like to keep the chamber nice and formed, and so being able to toggle the continuous infusion on and off with my foot pedals quite advantageous to be able to achieve this. And then I use the sweep, the Singer Coke sweeper, sweeping under the left side and then the right side. And then I go in with the cohesive viscoelastic cannula as I inject the lens, pushing a little bit more viscoelastic into the bag. I let the lens open up. And I prefer to use a cannula to tease the haptics off the optic. I've noticed with the ZC Boo lens, the haptics can be quite stubborn. And so I use that cannula, which I already had in my left hand, and I tease the haptics off. I go in with irrigation off and then activate irrigation. Get underneath the lens, removing the viscoelastic from within the bag, polishing under the rexus edge, removing all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, this is a fairly soft lens. I used a little bit of ultrasonic energy, but not that much. The Healon GV is quite advantageous because I'm able to use a single agent from beginning to end of the case. I am not exaggerating when I say it is the single best agent that I've used so far for capsule rexus. Because of the qualities of it, it does seem to compress the anterior capsule. So instead of it being bowed in a convex configuration, it's more flat. And so I have very little radialization forces when I use this viscoelastic for capsule rexus. And of course, because this is a soft lens, I feel comfortable using this viscoelastic. It really doesn't have very good endothelial coating power. It's really not designed for that. And therefore, because I'm using a soft lens and I'm using manual fracturing concepts and principles to cut the lens in pieces, again, I don't have to sculpt. I don't have to do any other of these maneuvers, and I'm able to minimize ultrasonic energy in vacuum. This has great expanding qualities as far as filling up the capsular bag for the lens implant, and then removal of the viscoelastic is super easy at the end of the case, as you saw here. And because it's so easy to remove, post-op pressure spikes is very, very low with this viscoelastic. And so this is my technique on a soft lens using Healon GV throughout the entire case and maximizing and leveraging manual fracturing techniques and concepts to essentially aspirate this lens out of the eye. So I hope this was helpful to you, and I thank you for your attention.